This is the small conference room with an AV check. All right.
Ladies and gentlemen, we'll begin in just a couple of minutes. All right, good afternoon, ladies and gentlemen, and thank you for joining us today for NORAD and U.S. Northern Command's virtual town hall to discuss COVID-19. As you can see, we're taking social distancing seriously here in the headquarters, and we'll be coming to you from different locations. We will begin shortly with opening comments from our commander, General Terrence O'Shaughnessy, and expect to have remarks by our command senior leader, Sergeant Major Paul McKenna. Also on hand to answer your questions is our Command Surgeon General, Captain Paul Kane. We have a number of questions that were submitted in advance, and so we'll begin there. And we will be prepared to take your questions now. So for those of you who are joining us from inside the command, please submit your questions by going to our internal COVID-19 portal page and click Got a Question. For those of you outside the command viewing us on Facebook Live, submit your questions via the comments box on Facebook. We'll begin in just a moment. So if I could get you to just be patient with us. We're working out one more technical issue, and it looks like we are good to go. So with no further ado, General O'Shaughnessy, sir, we're ready for your opening comments.
Well, thank you, Pamela, and good afternoon, everyone. As always, it's my absolute honor to have the watch with all of you, and I could not be more proud of the work the entire NORAD and U.S. NORTHCOM teams are doing during these challenging times. And as we continue our no-fail mission of defending our homelands, the health of our command and our family members remains our top priority. I know that we have a broad audience watching today, and it's great to have this opportunity to speak directly to our team members with the Sergeant Major and our surgeon. And I really want to thank the family members for joining us today as well, because we want to give you the latest information. Everything we're doing here is in line with the Secretary of Defense guidance to protect our service members and their family, safeguard our mission capabilities, and support the interagency whole-of-government approach. And COVID-19 or not, it should be absolutely no surprise to anyone in this audience that NORAD and U.S. Northern Command continue actively defending the homeland 24 hours a day, 7 days a week, 365 days of the year. And already in this month, just to show an example, on several occasions, we've had to intercept multiple Russian aircraft operating off the coast of Alaska. And we intercepted those aircraft with both U.S. and Canadian fighters, ensuring the Russian aircraft never entered the United States or Canadian sovereign territory or airspace. And additionally, we continue to be prepared for any other potential threats that we might face, including, for example, North Korea, as they potentially continue to test their missiles, as well as any other potential global threats to either the United States or Canada. And I give you that level of detail to illustrate the point that our commands are and will always continue to execute our homeland defense missions with the same capability and capacity we always bring to the fight. And that doesn't happen just by luck. It happens because we take deliberate actions and, for example, at this time, measures to ensure we're able to conduct our no-fail missions. And to ensure we can defend the homeland despite this pandemic, our command and control watch teams here in the headquarters split into multiple shifts, and portions of our watch team began working from Cheyenne Mountain Air Force Station, creating a third team in an alternate location as well. Our dedicated professionals of the NORAD and NORTHCOM Command and Control Watch have left their homes, said goodbye to their families, and are isolated from everyone to ensure they can stand the watch each and every day to defend our homelands. It's certainly not optimal, but it's absolutely necessary and appropriate given the situation. I appreciate your commitment and sacrifice, as well as the sacrifice of our families. So thank you all for that. And at the same time, U.S. Northern Command is contributing to the whole of America response to the COVID-19 pandemic. Starting all the way back on the 2nd of February, we issued an order to multiple military bases, directing them to prepare to receive and quarantine evacuated American citizens from Wuhan, China, in support of the Department of Health and Human Services, which at the time was the lead federal agency. And then on the 4th of February, we issued an order to additional 12 bases across the country to prepare and receive quarantine travelers screened at airports in the U.S. And on the 14th of February, we directed installations to prepare to receive and quarantine travelers returning from the U.S. from the Diamond Princess cruise ship. And finally, on March 20th, we directed our nation's two large hospital ships, the USNS Mercy and USNS Comfort, to deploy to FEMA-directed locations in the East and West Coast. Both Los Angeles and New York will be where these great ships are going to. They're going to relieve the pressure on the healthcare systems there in some of the most affected areas. And your actions have directly contributed to support the health and well-being of thousands of Americans across this nation. And just as you have time and time again, when your nation needs you, you responded, and even during difficult and challenging times. I don't need to go through each and every action we've taken, but I mention these few just to illustrate that we've been working the novel coronavirus issue for almost 2 months and will continue being proactive going forward. And this is a marathon, not a sprint. And we're currently operating under distributed operations, as Pamela mentioned, meaning we are isolating specific command personnel involved in different homeland defense functions. And while this especially applies to our watch teams, as I mentioned before, we've actually implemented it across every single directorate and every function within the headquarters. Our personnel are operating in physical zones within the building, and no one is crossing these predetermined zones. I've ordered everyone to closely monitor their own health as well as their family members, and to immediately cease coming to work if anyone in their family becomes ill with virus-type symptoms. And this is mitigating exposure to our personnel and their families, and to preserve our capability and capacity to execute our sacred Homeland Defense mission. This is a dynamic and evolving situation. I'm exceptionally proud of the work everyone is doing, and I understand the sacrifices you're making to ensure mission readiness. I'm proud of our watchstanders, I'm proud of our planners, I'm proud of our operations and technical folks, and I'm sincerely proud of all of those members of the NORAD and NORTHCOM team, to include our family members who are standing by us as we carry out this sacred responsibility. Thank you all. Please stay safe, and we'll get through this together. And as we mentioned, Sergeant Major's in a different room to keep that separation, but I would pass it to Sergeant Major for a few words to the team.
Thank you, boss. First and foremost, I want to echo a couple things the commander has clearly laid it out, and that is the sacrifices that our families, our friends, our loved ones, and our service members are making during our nation's critical need. I don't have to explain to everybody in this audience or around the globe just how serious this threat is globally, and now it is at our front door here at our nation. It's going to take each and every one of us to exercise personal responsibility in order to defeat this threat. The commander and I are calling upon each and every one of our service members, our family members, our communities to do the right thing at the right time. And that's taking personal responsibility and following the CDC guidelines as it pertains to hygiene. And simply washing your hands continually and consistently after activities will combat this virus. But most importantly, I will end with this. We want to hear what your concerns are. Because most importantly, in times like this, misinformation causes chaos and causes people to have panic and fear. The purpose of this venue, and the commander and I and the Surgeon General, is to clear up any uncertainty you may have or the misinformation that may be out there. So to get to further ado, let's get to your questions and find out what's on your mind. Over to you, Captain Coates.
Thank you, General O'Shaughnessy and Sergeant Major McKenna. So we'll begin with a question, and I believe this one will go to the commander. When the commander is finished, Sergeant Major, you may want to add something as well. The question is, why is U.S. Northern Command doing the opposite of what's being instructed by the President of the United States and the Governor of Colorado? General O'Shaughnessy, sir.
Yeah, well, thanks for asking that question, Pamela. And this is actually the same question I get from home. When I get ready to go to work in the morning, my wife, Donna, has asked me, why are you going to work? Why aren't you just staying at home? And the reality is this isn't in counter to what the President is telling us to do. In fact, the President's outlined some key mission areas that he knows that we as a nation must keep going forward. And clearly one of them is the defense of our great nation. And then we'll also look at some of the other mission areas that have the same level of responsibility with respect to having to continue this. And that, for example, our first responders, our healthcare workers, and even our food service industry that want to make sure that we as a nation can continue to function. And so when I look at it from that perspective, we clearly can't stop doing our mission. We have a sacred responsibility to defend our homelands, and that's for both the NORTHCOM and the NORAD side. And then the NORTHCOM side, we are key and front and center to the overall whole of America response for our nation to this COVID-19. And so we're absolutely following the President's guidelines. They actually give us some good parameters to work from. The CDC specifically publishes guidelines that if you must work, because you are in one of those mission sets, how do you actually do that in the safest and most effective and efficient way? And so that's what we're actually applying here within the headquarters. And when we pass to Sergeant Major for some amplifying remarks.
To keep this very simple, we are following the three bins that the Secretary of Defense has laid out. Number one, we protect the force. In order to protect the force, that means you got to wake up in the morning, put on this uniform, and stand a post. The second part of that is mission assurance, as the commander just clearly laid out. You know, we don't operate in a combatant command where we can turn off the lights and go home. We are 24/7, 365. And then finally, in order for us to support the interagency, to free up our capacity to get after some of the things they may need. So quite frankly, what a great time to wear the cloth of your nation.
Thank you, gentlemen. So the next question we have is, have any mission areas been impacted or curtailed as a result of COVID-19? And General O'Shaughnessy, if you'd like to begin, sir.
Yeah, actually they sure have. In fact, one of the things we've done is we've really prioritized the mission sets that we do, and clearly Homeland Defense is front and center to that for both the NORTHCOM and NORAD side. But we also find within the demand signal that we have and the response that we're doing for the COVID-19 and NORTHCOM side, for example, we do find that we have to free up capacity. And so we have taken some areas where, for example, some of our theater security cooperation areas where we can actually take that capability and apply that to the mission that has a higher priority in this temporal time frame. And so that's what we've done. We've actually done some training for some of our team members so that they can enjoy or they can be employed in some of the areas that we need help in. And that training has occurred and will continue to occur so that we can get the team all focused on the highest priority missions. And we've identified those missions that not so much that they're not important, but from a temporal aspect, we can afford to take a little bit of time off of that while we focus on this high priority mission. Over.
Thank you, General O'Shaughnessy. So we have a question for our command surgeon, and that question is, what can each person do to best control the spread of the virus? Over to you, Dr. Kane.
Thanks, Captain Kunze. So I'm glad you asked that question. There's a lot of rumors out there, or a lot of things that we can hear about, but the most important thing for us to do right now, since there is no way to treat this disease directly, is to try and prevent getting it. And the best way to do that right now is to practice social distancing. So what does that mean? Well, that means doing the best you can to minimize your contact with other people, minimizing the amount of people you have in any one room to the fewest amount possible, but certainly to less than 10 if you can help that. And staying at home as much as possible. You know, to General O'Shaughnessy's point earlier, we can't stay at home. We have to come in and do our mission. But if you can stay at home, if there's not a reason for you to go out, go ahead and stay at home except for emergencies. But if you do have to go out, make sure you stay as far away from people as you can. A minimum of 6 feet between people will help prevent the spread of the disease between people. And then practicing all the other techniques that even Sergeant Major started mentioning earlier. Washing your hands frequently, don't go out when you're sick, staying away from sick people as much as possible, and all the other guidelines that the CDC has out there that the military has been practicing throughout this whole time that we've been combating COVID-19.
Thank you. Sergeant Major McKenna, we have a question, and that is for Sergeant Major McKenna. What is your message to the families of NORAD and NORTHCOM right now? What do they need to know during COVID-19?
Us, and that's Canada. Our families need to know that the strength of our country is the strength of our people, and we will get through this together. Over.
Thank you, Sergeant Major McKenna. So we have a live question that's been submitted, and that is, are there any details that can be shared regarding any COVID-19 cases here locally?
Yeah, well, let me, I know we have to protect individuals, the personal identity type things from that, but I would ask the surgeon to kind of give the broad level situation. Over.
Yes, sir. So yeah, there are locally here for the Peterson Air Force Base area 2 cases that have been identified amongst people that live and work on our base. Those people are being well cared for. They're in home isolation, which means that they're not even sick enough to require hospitalization. The local medical facility has good touch points with the local community. And the spread in the area so far remains relatively low compared to the rest of the nation. For El Paso County, for example, we're up to just under 70 cases, around 69 cases or so throughout the county. But for the state of Colorado, even that's actually below the state's average when we look at the number of cases per 100,000 people. So you can tell we're monitoring this closely. The base is monitoring it closely, and again, that's why we're taking all the precautions we can to know that we're trying to prevent the spread. But when we do have some spread of the disease, and inevitably more people will become sick that are within not only our NORTHCOM family, but also within the base and local community. We want to make sure we're looking at the resources to take care of them and make sure that they have the resources available. And that's why we want to try and decrease the spread of the disease. The longer we can keep this down to a manageable level, the less likely we are to run out of medical resources to help take care of everybody.
Thank you, Captain Kane. All right, so we have another question, and that is for General O'Shaughnessy. Have you delegated your authority for travel exceptions down to a level that, as was outlined in the so Deputy Secretary of Defense memorandum regarding travel restrictions for DoD military personnel, military and civilian personnel assigned to the command?
Yeah, so the guidance that we've been given is pretty clear with respect to ensuring that we don't become part of the problem. And what I mean by that we don't become part of the problem is what we don't want to be doing is, as we look at the restrictions that have been in place and the guidance that's been given at the national level, we don't, within the Department of Defense, don't want to be bringing the virus from one area of the country to another area of the country. And so therefore, to the largest extent possible, we are abiding by those restrictions until, in fact, until the 11th of May, per the guidance from the Secretary of Defense. Our intent is, and the Secretary's intent is, there are always exceptions to every rule that you would put in place. And for some people, whether it be for maybe a medical emergency, maybe it be from a family emergency, maybe it's because of the importance of the particular mission set that they're going to go do and travel to do. There are going to be exceptions to that, and so we, of course, are allowing those exceptions. But the approach that we've taken is those are, in fact, exceptions. They're not the rule. And by, we are trying to abide by the SecDef's guidance that we aren't doing travel that is not necessary. Now, that said, we're pretty busy right now, but we also are authorizing leave on some cases where it makes sense in the local area. But I will tell you right now, we're in a pretty much all hands on deck situation based on the COVID-19 response while simultaneously being able to defend the homeland. And so we ask for everyone's indulgence to us of continuing to focus on the mission as much as possible.
Thank you, General O'Shaughnessy. So we have a question now for the Sergeant Major. And Sergeant Major McKenna, we have a viewer who would like to know what guidance you're giving to enlisted leaders, both in the headquarters and across the commands that report to U.S. Northern Command.
Well, first, thanks for the question. We have the most professional enlisted force in the world, hands down. My message to both our components, regions, and subordinate commands, as well as our senior enlisted leaders here in the headquarters, is simple. Now is the time for you to step up and, with your years of experience and leadership, offer the sound advice and counsel to our officers, to our civil servants, to our contractors, to the entire workforce. And this is the time where your junior enlisted are going to be looking to you for an example. How are you conducting yourself on a daily basis? Are you demonstrating the poise and professionalism needed in a crisis? Are you operating with a cool head? Are you displaying a level of empathy? Because our junior enlisted are watching. And I would offer you this. This message is very clear. As the commander just pointed out, this is a marathon. You know, this is not something where you can just do a high five and say, how are you doing today? You got to drill down and get engaged with those people that you have been charged to lead. And it's not just on Monday, Wednesday, Friday. It's 7 days a week, 24/7. So yeah, we're going to work around the clock. Some of us are going to get less sleep. And as the commander pointed out, this is not a time to take a knee. This is a time to step up and be counted. And that's what I expect from every senior enlisted leader.
Thank you, Sergeant Major McKenna. Also, thank you to our viewers. We're getting a lot of really great questions. And the latest one is, if a service member is in isolation or required at their duty location and someone in their home gets sick, will that service member or command member be relieved from their duties in order to take care of that sick family member?
Yeah, so I'll go ahead and take that one. And so one of the reasons that we have the teams isolate like ours is because of the mission assurance, right? We want to make sure we have the right skill set available at the right time. However, we also understand that there will be things that will happen. And so we have tried to put some redundancy and some level of resiliency into our posturing of the force. And so whilst we won't be able to respond to every things that happen at home as life does happen, what we will be able to respond to is those that are of such a significant level that we need to take our service member, allow them to spend time with their family, respond to the family emergency, take good care of their family. And so what I would encourage all to do is, if you find yourself in a situation where one of the team members that's in isolation is truly needed at home, based on something happened at home, that you talk to your supervisor, and we'll work our way through that challenging time. In the end, we know that our families are making sacrifices. We also know that sometimes things do happen that are not happening at the optimum time. And if that case happens, when a family member gets seriously sick, there's another family emergency of some kind, then we'll take the appropriate action and free that member up to take care of their family.
Thank you, sir. So we're, for our viewers, we have about 5 minutes left here. We have a couple of questions. The first one is to the Surgeon General, and that is, how is the command, or how are our commands staying connected with senior health organizations such as HHS, CDC, Joint Staff, and others?
Thanks, Captain Kuzi. So we actually have very frequent contact with both our external organizations, that being Health and Human Services and Centers for Disease Control, multiple emails, phone calls, and video meetings on a regular basis. We actually reach out to our embedded personnel that we have, our LNOs, in those organizations, to make sure that we remain aligned with the overall whole of America effort, and that we keep up to date with the guidelines as they continue to evolve, because this being a new disease and a new situation, things are changing as we move along and we get more information. Additionally, we have that same level of contact, multiple calls every day, with the Joint Staff Surgeon's Office, as well as our sister combatant command surgeons and the service surgeons and offices, to make sure that we're all on the same playing field. We all share the same amount of information, the same updates, so that we can align all of our efforts for the whole response, not just from the military, but aligned with all our partner agencies.
Thank you. So I have, this will in all likelihood be our final question. And this one is one we've seen quite a bit. So teleworking has been the #1 recommended course of action on every piece of literature I've read from multiple sources, and go on to list many of the different official sources, to help prevent the spread of the disease while allowing people to keep working. Understanding there are limitations on teleworking, why aren't we going to 100% teleworking except for the functions that can't be done outside of the building? The person goes on to say, I've been told that the issue is equipment, but I'm able to use my own IT systems for the past week. It hasn't been perfect, but it is working. So essentially the question is, is there any expectation that the workforce will go to 100% teleworking except for those specifically identified mission areas? I'll start with you, General O'Shaughnessy.
Yeah, well, actually, thanks for highlighting that. First off, our mission does just not lend itself to 100% teleworking. It's just not compatible with that, given the nature of the business that we do. That said, we are looking for opportunities and ways that we can effectively disperse the workforce, and in some cases actually telework. And as an example, the way we're pursuing this is not just trying to provide, different laptops. Well, we've actually, in fact, yesterday I spent a couple hours on the phone with the Vice President of Apple, trying to find ways that they could help us find new technology or technology that would allow us to do our mission set, which is not the same as everyone else's mission set, and ways that we could do that to increase the number that could telework. Some promising things there are J6 has taken on, and it shows some of the public-private partnerships out there with Apple proactively reached out to us to see if there's something they could do to help us. That said, I don't want to set a false expectation. Much of the work we do, there's just no physical way to do it by teleworking. It's the command and control that we do, the coordination that we do, and the pace of which that's moving. So we are going to look, especially as we maybe see increased coronavirus positives here in the local areas, where we continue to disperse the force and continue to have more folks being able to work from home. But it is challenging given our mission set, and we have to maintain our ability to defend our nation and respond to the COVID-19. So we'll continue to work our way through that, but I think in the end, a large portion of our force will have to come to work every day, and then we have to find ways to do that safely through the social distancing, through exactly what we're doing right now, where we're all in separate VTCs in order to get the mission done. And let me ask if Sergeant Major has anything to add to that.
Sir, not to pile on, I think you answered it pretty clearly with respect to telework. But before you give your closing comments, and I understand we're under a little bit of a timeline, I do want to offer you this. To everybody out there that's listening right now, I got two things for you. One, how are you making yourself a hard target? How are you going about so you don't catch this virus? And number two, what are your current lifestyle choices that you're making? And I offer myself as an example. Listen, when this all started to come to fruition and we saw it creep into our front door, I had to look in the mirror and do some self-reflection and said, are the choices that I'm making in my life making me susceptible to this virus? I.e., why am I dipping Copenhagen? Am I drinking a little too much? These lifestyle choices, I said to myself, right here, right now, I am not going to be a victim to this virus. So I gave up Copenhagen. I gave up drinking. Why? Because those choices that I make are affecting others. What would happen if I got sick and infected the commander? Could you imagine? I mean, what would happen to the national leadership here? That's what I want you to look at right here, right now. The choices that you are making or not making that affect the team. All right? That's what we all need to do right here, right now, is look in the mirror and say, how do I make myself a harder target? How do I make myself a better teammate by the choices that I'm going to make going forward? That's how we beat this virus. Thank you, boss.
Thank you, Sergeant Major. So as we've already discussed, we are very quickly approaching the end of our time for this town hall. We have had a number of questions submitted that we haven't had time to get to. And in fact, one of the questions that was submitted was, how are you going to answer the questions you don't have time to answer during this live stream? So we will continue to work answers to your questions, working with our leaders here, and we'll make those answers available to you, whether it's on Facebook or through some of our other command information tools. So we'll work to get answers, because there are a lot of really, really great questions, and we do appreciate everybody's involvement. So ladies and gentlemen, that is all the time we have for questions. General O'Shaughnessy, would you like to make any final comments, sir?
Sure. I first just say to my teammates here and sharing the watch with me, and to the families that support us, we fully acknowledge these are challenging times, but we're going to get through this. Okay, we're going to work our way through it. We're going to be able to defend our nation. We're going to keep each other safe, and we will get through to a better place on the other side of this COVID-19 fight that we're in. As we do so, we're going to do it together. As the Sergeant Major said, we're going to take personal responsibility for our actions and make sure that we are minimizing the risk that we are taking. We're going to take care of our family members, our service members and their families. We're going to maintain our ability to do our mission, and we're going to support the interagency and the whole of America approach on the NORTHCOM side. I could not be prouder of this team. As I've watched this team already in the couple months that we've been working this, get through some really challenging times, and there are folks that are working their tails off right now. I understand that, I acknowledge it, and I'm incredibly appreciative of it. I know our national leadership understands what we're doing as NORTHCOM and NORAD, I get kudos all the time from the senior, our senior level national leadership. We were called out on numerous occasions in a White House task force sessions with the Vice President and the President, directly contributing NORTHCOM and thanking NORTHCOM for the great work that we were doing. So we have a mission to do. We're going to do that mission while keeping each other safe. It's my honor and privilege, just as it is with the Sergeant Major, to be part of this team, and I thank you all for what you're doing, and we're committed to try to keep the information flowing. Under Pamela's leadership, we've been pushing out some different products, putting things on the websites, trying to make sure that we are giving you the latest and greatest information that we have, because we know we're getting through this together with our service members and their families. So thank you all very much.
Thank you, and that concludes our town hall.